Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In continuation with the Module 2, we will be focusing on today's lecture on managerial indicators in the healthcare quality. In the previous chapter, we have studied with the clinical indicators, and now in this chapter, we will be studying with the managerial indicators. So in this chapter, we will be studying what are managerial indicators, that is called as KPI, key for performance indicators, and what is the use of this in the different areas in the healthcare, and what is the framework for selecting and implementing these KPIs. So in introduction, we would say that managerial indicators are quantifiable measurements. They are often referred to as key performance indicators, utilized to assess the effectiveness and the overall performance of managers and the specific business operations they supervise. These metrics deliver data supported insights that enables managers to make informed decisions, maintain alignment with strategic objectives, and proactively pinpoint opportunities for operational improvement. The consistent monitoring of this performance metric provides essential support for evidence-based decision making and promotes a culture of accountability and continuous service enhancement within the organization. So when we point out towards these managerial indicators in the healthcare, first is the purpose, that is called as the optimize workflow, control cost, improve staff management, and support strategic planning. So this is the last phase, that is the purpose that a managerial indicator is set up. But when we need to start, we need to think on what is actually the managerial indicator tracking on. It tracks the operational health part. It evaluates the leadership. It monitors actually the resource utilization. So the very first part that you need to first focus is on the definition, like how managerial indicators have been taken. Then comes the importance of it. It enhances the decision making, it increases the efficiency part, it ensures the financial stability and promote accountability. If I have to go with the examples of this, where you can say the average length of the stay, the patient waiting time, the staff turnover rate, and the operating margin are the examples of managerial indicators. What is the reason we need to discuss on this and we need to focus it on the healthcare? That is the purpose. The purpose is optimizing the workflow, as I said, and to even the cost control, improving the staff management and supporting the strategic planning the hospital is taking ahead with. So overall, we are trying to focus that states that the importance, purpose and examples of this. Why managerial indicators KPIs are important? As we have seen in the previous diagram over here, that how this managerial indicators in healthcare really comes up as. So why managerial indicators or KPIs are important? These indicators provide crucial information that helps find areas needing improvement, make processes better, and ensure that high quality care is delivered to the patients. The patients are expecting the high quality of care, and which is being delivered with the help of managerial indicators along with the clinical indicators. Healthcare key performance indicators are often grouped into categories. There are different categories that you will be able to see, that is the operational efficiency, financial health, quality of care, patient safety and public health outcomes. These are essential because they help organizations. They help hospital healthcare organization. They essentially come up to improve the patient outcomes, where the KPIs track the quality of care, patient satisfaction and the safety, which ensures that the patient receives the best possible treatment. It improves the operational efficiency by measuring the things like patient waiting times and how resources are used. Organization can simplify their operations, reduce the cost and provide better service. Also, it ensures the financial sustainability. The key performance indicators focused on financial management, which is processing the insurance claims, cost per discharge. It helps the organization manage its money effectively. Also, it maintains the compliance and standards. KPIs also help organization meet regulatory requirement. They provide that flow, establish the best practices. The key performance indicators in the healthcare measure success across several important categories. The categories can be quality of patient care, it can be workforce management, it can be financial health, and it can be program effectiveness. These KPIs are selected to align with the specific objectives of healthcare organization. By monitoring these KPIs, hospitals and clinics can easily spot the trends. The trends which is very important that we have discussed in the previous chapter. Finding the areas that are insufficient or recognize whether they are performing exceptionally well. If not, then you have to work on these KPIs. For instance, if your hospital is facing low infection rate and low patient readmission rates, it is direct indicator of a high quality care. That way you can be assured that yes, everything is going well. Similarly, if you find the employee engagement score reflect the overall health and morale of the staff, where if you find that the employees are engaged properly, you may see their working performance is being increased. Consistently tracking this KPI helps organization make decisions based on factual data. The factual data is very important to foster a culture where employees are accountable and they are being focused on the continuous improvement which is expected by the healthcare organization. KPIs in different areas under healthcare. We may find that it is an enhancing care standards, and with respect to quality, quality key performance indicators are focused on checking how safe and effective care is being delivered, how safe and effective care has to be provided to the patient. If I have to give you the examples of this, these are like scores showing how satisfied patients are. You need to work on this part where it is very important. The satisfaction of the patient matters a lot. Rates of patients who have to be readmitted to the hospital soon after being discharged. Rates of infection acquired while a patient is receiving a healthcare, which is very important to show how your infection control practices are being there in the hospital. These all the metrics which I have given in the examples are directly reflecting the patient's overall experience and the actual clinical results of the treatment, which is very important for any organization. But by regularly examining this quality KPIs, healthcare providers, hospital employees can identify gaps in their system. They can take immediate steps to improve how they deliver this care. How they will do that? By tracking these measures. The measures can be tracked consistently over a time. Often that leads to better results. What will be they doing? They will be doing during official accreditation reviews. And this all will reflect on the patient's trust. The patient's trust will be increasing on the hospital. What are workforce KPIs? Are there any such KPIs that can improve the workforce, the hospital employees' workforce? Yes, it is assessing the human capital. You may find the human capital in the hospital has to be measured. The workforce KPIs are used to measure the staff's performance. They involve, they motivated, and how long they stay in the organization. So the very important thing is that motivation, engagement, and the retention part, which is very important for any organization to engage their employees and to work on their human capital. The common metrics that they can use is staff turnover rate. No doubt it is a part of the HR, no doubt it is one which is working on the organization behavioral theories and engaging the patients through their employees, where employee engagement works more closely on improving the patient's outcome. Staff turnover rate, employee engagement score, the speed and frequency of staff completing necessary training. Because the training will reflect on the skills and the skills will ultimately improve the health outcomes of the patient. What are these indicators highlighting at? These indicators highlight the organization's internal health and work environment. These indicators pinpoints the needs for professional development and ultimately it influences the patient outcomes. A motivated and full trained staff is crucial for delivering both safe and compassionate care. Compassionate care is very important to be emphasized over there, which is very important. When we find a compassionate care, it is one where the patient gets maximum satisfaction. No doubt, along with compassionate care, we need to have a safe care, which is very important. By monitoring workforce KPIs, management can effectively address issues like burnouts, which is very important problem now currently going in Indian hospitals. We may find the burnout issues of the doctors, the burnout issues of the nurses. So you need to enhance the strategies aim as keeping valuable employees, where when you find that some of your employees are putting a great value to your organization and you are not working on retaining them. So you need to build up the strategies, and the strategies will be built with the help of this working workforce KPIs. Financial KPIs. When we have studied the human resource part and now you are going towards maintaining the operational health, it is very important to sustain an organization. Financial key performance indicators assess the economic well-being of the healthcare organization, which is very important to see that if the economic well-being is being seen, your organization will sustain. What are the important metrics in this category? The important metrics are the income generated per patients, the cost required to perform a specific medical treatment, operating margins. So these are some of the important metrics in this category and you can work on this in your institutions. These KPI offer a clear understanding of the organization's ability, the ability to provide efficient care, but while remaining financially responsible for that also, which is very important to be aware. Financial indicators are also vital tools for strategic planning, setting the prices for the services and managing the yearly budget. So I emphasize here, financial indicators are also vital tools for all these three important things: strategic planning, the prices and the yearly budget. By using KPIs in their decisions, leaders can achieve a balance between providing a healthcare quality, which is a very high, and ensuring organizations' long-term survival. Programmatic KPIs. These KPIs are measuring the initiative success. You might be taking a lot of initiatives, but what is the success, how it is to be measured, and how you need to put the measurement for that part. So programmatic KPIs evaluate the impact of specific health programs and initiatives. There are a lot of health programs which are taken by the organization. Even in public hospitals also, you may see that there are many indicators that will be put according to the programmatic KPIs. Examples are like patient outcome improvements, program completion rate, and publication of the research findings. These are few of the examples that can be seen as programmatic KPIs. These indicators helps to determine whether by new or ongoing initiatives are yielding positive results, whether need to be improved, whether they need to be curtailed. So they also provide accountability for grants, funding sources, and give a strong support to the organizations. Programmatic KPIs are essentially valuable in preventive health and even community outreach programs. There are many of the programs where you may find that there are quality issues with respect to the national health programs I am talking about. What is the framework for selecting and implementing this KPI? This is a very important part that you need to understand. A structured framework for KPI selection begins with identifying the SMART goals. The SMART goals are the one goals that are very important to be understood with respect to this KPI. The SMART can be from the word SMART, that is specific, measurable, achievable, relevant and time bounded. Where the S stands for specific, M stands for measurable, A stands for achievable, R stands for relevant and T stands for time bound. And thereby you may find that this is a SMART goal that has to be achieved. From these goals, organization can select the KPIs that best reflect the progress and the priorities. Somewhere or the other, you may find that time bounded is not a thing which is not followed, or sometimes we may find that the achievables are not one which are being seen as. So you may prioritize the thing, or you may progress with some of the aspects that needs to be taken by the organization. It's also important to determine the data availability, stakeholders relevance, and tracking mechanisms. So this approach ensures consistency, alignment, and transparency across all the departments of the hospital. An effective framework maximizes the utility of KPIs for strategic planning. There are these of the examples of managerial indicators in healthcare. With respect to service utilization indicators, I would like to highlight with few of the very important indicators over here which you need to take up for the practice. That is bed occupancy rate, then is the average length of the stay. How much average length of a stay with respect to a disease condition in there, and how is the extended length of the stay you can take it. Bed turnover rate, which is one which is say that how the bed is being utilized after that. OPD attendance, outpatient visits per day, which is very important to be calculated, and you may get actually the performance of your OPD. Emergency department visits, which is one of the reasons that all the emergency department can be improved with the service utilization parts. Admission rate, which is one of very fine hospital statistics that the hospital administrators and the quality team needs to be focused on. Surgery procedure, volume per month, and referral rate, which are one of the important service utilization indicators which can be seen as an example of managerial indicators. Second, into the managerial indicators, we may find the human resource or workforce indicators used to manage staff workload and productivity. Staff patient ratio, where you may see the nurse patient ratio versus a doctor patient ratio, which is to be found that we have very low in our most of our hospital, especially I am talking about public hospitals, which needs to be improved with the help of the workforce indicator. Staff turnover rate, which is a problem actually we might be seeing with respect to Indian hospitals and the growing situations actually for that. Staff absenteeism rate will be one which will be focusing and pointing out towards the HR problem and the relationship of the employee on the organization. Overtime hours per staff, where the hospitals can be seen as giving incentives to those staffs who are working more with respect to the organizations where it is pointing out. Training hours per employee, the investment that the organization is doing and how the skills are being enhanced with respect to the training which is provided. It can be in-house, it can be out. Vacancy position filled, where you may find the lack or the unfilled vacancy, and the hospital can work on this part. And the lastly, which is very important, employee satisfaction score, which is one way actually you can see that if your employees are satisfied, it may um, directly connect with the patient satisfaction score. Financial and cost indicators, many times these are the one indicators which may say how an organization really will sustain in long terms, whether there is a future for this organization to take ahead. Track financial performance and resources like cost per bed, cost per case, particularly for a patient and particularly for a bed. Revenue per bed, how it is generated, what is the importance of getting this is very important. Then comes the billing turnover time actually, where you can see, and many a times you may come across the budget utilization, pharmacy expenditure, and department wise also you can see the expenditure. Insurance claim rejection rate, and so are all and many others in the financial and cost indicators. Supply chain and inventory indicators, which is very important that most of the organization when they are taking all these indicators, they need to see that what is their left stock, what is the inventory, lead time, cold chain failures, and expired medicine. This will give you the performance of the organization, how they have really come up with. With this, you can find and improve the lags actually, which starts from monitoring to going to a greater extent into micro aspects of the department. With respect to equipment and infrastructure, do we need to have an indicators? Yes. The tracking, the functionality and availability of the equipment is very important, and this is one of the reason actually that when we are putting this in the tracking part and functionality and availability, the equipment may be seen as one of the best way that you can measure the performance and the utility. Equipment downtime, which is very important now, where we have to focus on preventive maintenance and compliance rate, where whether we need to work on the maintenance part, whether the downtime is more or less actually, and availability of essential equipment, whether your organization is having it or not actually, which is one reason that most of the organization works more specific on improving these indicators. MRI, CT machine utilization rate, which will give you most of the revenue part of that. Operation theatre utilization, which will help you to work on the flow of the patient, which is very important to be seen as. Then comes the access and timeliness indicators. Are there any things with respect to access and timeliness to be seen? Yes, it is. These indicators help you to measure the waiting times and access to care, which is a very important problem to Indian hospital, specifically when we say waiting times. And second is access to care, which you find most of the claims actually which comes to the hospitals or the litigations are more also counting this micro aspect as whether the organization has worked or not for this two part. Average waiting time, most of the time actually the hospital can see and check actually whether the OPD time or the lab or radiology and all other referrals are being seen and whether they are crossing actually with respect to this. Turnaround time for the lab report, which may say that yes, how the lab is really functioning. What sort of delays are there? What is the problem with respect to that? Turnaround time for the diagnostic test, particularly CT, MRI, X-ray, and so on. Appointment scheduling efficiency, how and in what way it is being done. Patient transport response rate, which is one of the indicators which will entirely show that how your patient transport response is. Now comes the patient experience administrative indicators. Most of the time the management really needs to focus on this and many others in the line actually to these indicators which I have mentioned over there. Reflect patient-centered service management, patient satisfaction score, which many times is being ignored, and so where we find the reflection of that on that trust of the patient, patient choice for your organization, patient's image towards the organization. Complaints per 1000 patient, which is very important, out of how many of the 1000 patients actually people have given, whether it is 2 or whether it is 10 or whether it is 50 or increasing in trends, which is very important to be seen that most of the organization don't even focus on getting the complaints or the feedbacks. Discharge process time, whether your discharge is really a planned discharge, whether your discharge is completed with all the medicines, whether your discharge is followed with instructions. These are very important part that your organization needs to work on this, where many times registration time to the discharge time also can be seen as a very important indicator. Call bell response time is one among added actually into this series to understand what are the indicators really working for. Quality and safety related manager indicators. Why not to be seen into the clinical indicators versus to managerial indicators? Here you may find it is directly connected with the management. Medication errors reporting rate, how many of the time when the medication error has been done versus how it is being reported, which is many times who are the responsible factors who are making it lesser actually to be reporting. Adverse event reporting, how are the organizations really helping the employees actually to report more, rather not saying more, report when the event has occurred, which is very important to justify the organization's view actually for this part. Infection prevention compliance, which is very important, as we are finding that lot of issues Indian organizations are facing with respect to this. Hand hygiene compliance, which needs to be improved with respect to the infection control and even the HAIs that burden actually that we are facing. Readmission rate is one where it is entirely focusing on the image and the improvement of the hospital's plan and purposes actually, which we need to see. So at last, when we find that entire discussion of these managerial indicators are being focusing on measurement, because without measuring these data points and using this for the administrators or the quality team, there is no purpose of making this monitoring. The monitoring efficiency, the resources used, the staffing, the finances, and overall performance, which is very much to be helpful to be understood with the help of these managerial indicators. These indicators helps manager to track the service utilization. It can be with respect to bed occupancy, patient flow, outpatient volume, length of the stay of the patient, or to access how well resources or the services are functioning. So workforce related indicators like staff patient ratio, the absenteeism part, the turnover rate, and support decisions are all making the staff towards their advocacy, productivity, and workplace planning. So with respect, there are many other pointers actually that we have covered in this chapter with respect to financial and supply indicators, infrastructure and equipment indicators, and together we can say that managerial indicators are support evidence based decision making. They are improving the operational efficiency, they are strengthening towards the overall quality and responsiveness of a healthcare service. So we've understood here in this chapter that managerial indicators equally play a role likewise to the quality clinical indicators in improving the patient outcome actually over there. So with this I come and end to this chapter's discussion, where you can find that the references which are being used are being taken for the notes for this entire topic, and you can work on measuring this, you can develop more and see that your organization gets major benefits from this KPI. So thank you for this today's learning.